And TMS offers a very specific localized treatment, and there is no other treatment in psychiatry which is so localized. It does not really disturb any other part of the brain, or for that matter, the whole body. You locate the prefrontal cortex, and then you put the probe over that, and it offers a 37-minute long procedure where it provides pulses of magnetic stimulation based on the need, which we determine that how much should be the threshold of stimulation would be, and that is delivered over 20 to 30 sessions, and within 12 to 15 sessions you have a fair amount of improvement in about 60% of the cases. This treatment is done very safely in a doctor's office in an outpatient setting. So you don't have to go to the hospital, you don't have to go to any other thing. You just going to a regular visit to a doctor's office. It's done, and you drive your car home without a problem. Most of my patients can do that, and I never had a problem, and I treated well over about 35, 40 patients. And remember, this treatment is often given to people who really have failed other kind of treatment or have not done well with other treatment. Though we don't have too much of clinical evidence or research evidence that it should be given to a first episode of depression, but I would say that if you have a treatment given to someone with a first episode where you don't have SSRI or SNRI treatments, I think it's probably going to be much more effective, and you don't have to go with all these other side effects with SSRIs. TMS offers very safe treatment. You know, a lot of people will think about magnetic stimulation. It's like ECT. Here, you walk into the office, you sit on the chair, and there's a small amount of noise happen, which is generated by this TMS machine, just like an MRI machine, and then you're done in 37 minutes. The most of the side effects are limited to some scalp pain or headache after the procedure, which is very mild. Most of the patients drive their car home after that. There are no long-term issues such as memory problem or any other issues. There are some minor problem with TMS, and one of the problem and limitation is that if you have a metallic object in your vicinity of your prefrontal cortex, such as within 6 inches from that, like orbital fossa or anywhere in the skull, that can be a reason you can't get the TMS, because often those areas can be stimulated and they heat up. So beside that, there's not that many issue with the TMS. There's a very, very, very small chance that you may have a seizure with any kind of stimulation that can happen, and most likely it can happen with just taking simple medications like Wellbutrin stimulant, which is much more commonly causes that than the TMS. Beside that, it's one of the safest way to treat a patient and without causing any issues. I've treated many patients with TMS, and some of the success stories are in postpartum depression, severe postpartum depression, almost catatonic, with no previous history of depression. A patient I treated who improved within 15 treatment back to normal within 15 days. And antidepressants don't do that. They take many weeks, if not, to be effective. And you would expose your child to be, to medication, because if they're going to breastfeed. So there are a lot of advantages in certain given circumstances with TMS, which you don't have with other treatment. It is one of the procedures which is safe and well documented that it works. There are some limitations. Most of the limitations are related with cost, because it's a new treatment. It is somewhat expensive, but all good treatments have